What do stomach pain, food allergies, numbness, insomnia, and depression all have in common? They are all commonly missed symptoms of Lyme disease. Following Justin Bieber's surprising Lyme diagnosis, many news outlets have been putting out lists of common Lyme symptoms. Let's do some fact checking and see what you really should be looking out for when you're thinking about Lyme disease. And let's talk about some of the symptoms that should have really clued in Justin Bieber's doctors into Lyme disease. The U.S. Centers for Disease Control and Prevention, or the CDC, tells us that the classic symptoms of acute Lyme disease are, typically fever, headache, fatigue, and a characteristic skin rash that's called erythema migrans, more commonly known as the bullseye rash. But why worry? Doesn't everyone find a tick, and doesn't everybody get that rash? The medical research shows us that as many as 50 to 60% of patients don't remember getting bitten by a tick, and despite the CDC telling us that the erythema migrans bullseye rash is present in at least 70% of patients, the research actually shows it's more like 40 to 60%. So there's a 50-50 chance that you'll find a tick biting you, and there's a 50-50 chance that you're going to get a rash. So these odds aren't really all that good. And you have to think about it. If you have vague flu-like symptoms, especially without a cough, without a runny nose, without a sore throat, or in the middle of the summer, you really may need to consider Lyme disease. Making matters worse, in a summary of the best available medical evidence, this is called the meta-analysis, Stricker and Johnson actually found that the standard two-test Lyme disease test used by most doctors and recommended by the CDC is effective only 56% of the time. So once again, it's like a coin toss, right? So the good news is about this testing strategy is if you are positive, you actually have a 99% chance that Lyme disease is the correct diagnosis. But what if the rash is not present? The initial symptoms of Lyme are usually vague, such as fatigue, achiness, just feeling off. And if it's not high on your doctor's radar because they don't see a rash on you, then the diagnosis of Lyme is often not made early enough. The CDC tells us, if left untreated, infection can spread the joints, the heart, and the nervous system. Late Lyme disease is characterized by more neurological, cardiac, and joint involvement. It moves from a vague flu-like illness into a more of a multi-system presentation. If you're lucky, you might get a hot, swollen knee, big swollen knee, and that could clue your doctor into the diagnosis more quickly. But if you're like most people, including Justin Bieber, the spread of these symptoms is insidious and they slowly creep in over time. Some of the most common symptoms include changes in brain function, slow thinking, forgetfulness, word-finding issues, difficulties multitasking or doing other higher order processing, things like math, and just, everything you do every day at work and at home to make your lives easier. And in children, we often see things like regression in writing, reading, and behavior, as well as emotional maturity. Kids who have been previously amazing students are often struggling academically. Sometimes they'll get a new diagnosis of ADHD, even though they've really never had symptoms of this disorder before. Headaches, heart palpitation, dizziness, these things are all really common as well. There's also gastrointestinal symptoms such as stomach pain, nausea. There's a lack of desire to eat in some folks. New food intolerances can happen. And this is actually really common to see gastrointestinal symptoms in children. Things like depression, anxiety, irritability, rage, and even OCD can develop. And this can be either directly caused by the infection or due to the prolonged suffering of an undiagnosed illness and frequently being told by the doctors you're going to see that there's nothing physically wrong with you and really it's just all in your head. I often see that these kind of psychiatric symptoms are often triggered by the infection through a process called infection-induced autoimmune encephalitis, basically meaning that the Lyme infection triggers autoimmunity, and both that infection and this newly triggered autoimmune process cause inflammation. This inflammation triggers neuropsychiatric symptoms by irritating the brain. This is frequently known as PANS, or Pediatric Acute Onset Neuropsychiatric Syndrome. And, this is most commonly described in children, as the pediatric part tells us, but also this can happen in adults as well. So infection-induced autoimmune encephalopathy is a really important thing to consider. The key to prevention of chronic Lyme disease is early recognition of the symptoms of Lyme, early diagnosis, and early treatment. So armed with all of this knowledge, you'll be better prepared to spot potential symptoms of Lyme disease early. There are so many other nuanced symptoms that go along with Lyme disease, but we've covered some of the big ones that you should be aware of. Thanks for joining me. If you found this video useful, please click the like button below. And while you're at it, make sure you subscribe and turn on notifications so that you don't miss any of my future videos, where I'll continue to dive deep into Lyme and all the other things associated with it so that you can be armed with the information to protect yourself. And if one of you or your family members happen to get Lyme disease, you'll be picking up on those symptoms early. I'm Dr. Tom Moorcroft, America's Beyond Lyme expert, wishing you all the best in health. We'll see you next time.